now joined by three members of Parliament. Adam van Loeverden is the Parliamentary Secretary to the Minister of Health, also the Liberal MP for the Ontario riding of Milton. Dr. Stephen Ellis is the Conservative health critic and the MP for the riding of Cumberland-Colchester in Nova Scotia. And Don Davies is the NDP member for the riding of Vancouver-Kingsway and sits on the Common Standing Committee on Health. Welcome to the three of you. We invited you here to initially talk about healthcare, and we will get there, but I did want to first and foremost give you guys the opportunity to talk about what happened in Laval today. Mr. van Loeverden, your thoughts on the matter?
Well, it's just such a horrible, horrible tragedy, and I know that I speak for every member of the House of Commons and certainly Canadians from coast to coast to coast when I express condolences and say that we're all grieving together. This isn't just a tragedy for the families in Laval. It's one that every Canadian will feel. And when parents drop their kids off at daycare, they have an expectation that they're going to see their kids at the end of the day. And my heart goes out to the families that are impacted. It's such a tragedy.
Dr. Ellis?
Well, thank you, Michael. And certainly I want to echo the comments of my colleague. And as a grandfather of two children about the same age, it's one of those situations that one can't even imagine to put yourself in, to understand the grief of those families affected by this, the parents, the grandparents, the siblings. And this is something that we as Canadians will feel for a very, very long time. And I know that we'll come together as Canadians and support those families.
Mr. Davies?
Well, I join with my colleagues who I think said it so eloquently. What a tragedy of unbelievable epic proportions. I can't think of a more horrific event that could happen to anybody, and so as many have said, there are no words. I think it's a time for us just to open our hearts and send out our strongest feelings of strength and healing to the families involved and to all the children, and it's really unimaginable what they're going through, but all of Canada agrees with them.
Absolutely. Thank you. Thank you for that. I didn't think it was appropriate to begin any conversation today without acknowledging what happened in Laval, Quebec. So we'll, of course, keep following the story and keep following the investigation. But for now, let's turn back to the original intention of the panel and to discuss the healthcare proposal that came out yesterday.
A lot in the way of new funding. That is a part of this package that has been put together by the federal government. And so, I think to say the least, I think we were a little disappointed at that.
Well, that was Heather Stephenson, the Premier of Manitoba, also the current chair of the Council of the Federation, reacting to the federal government's funding proposal for healthcare. Now, the dollar figure is tens of billions of dollars less than what the provinces were looking for annually. And provincial officials, well, they are right now assessing how the proposed amounts might affect their own healthcare agendas. So with that, let's bring in the MPs once again. Mr. van Loeverden, I'll begin with you. The provinces, as you heard there, say they are disappointed with the money that's on the table. The Conservative leader also calling the money inadequate. Are you worried Canadians will judge Liberals harshly for not responding to the healthcare crisis, essentially with more dollars?
Well, first of all, thank you, Michael. I would say that this is the largest ever increase to this transfer and a $198 billion investment in our healthcare over the next 10 years. Not only is it a staggering number, it's also targeted investments in really specific areas that my colleagues and I from the Health Committee have identified as key areas of need. I was actually grateful to hear today that the leader of the Conservative Party, Pierre Poilievre, said that he would respect this agreement and the notion that he would also respect that this agreement is in accordance with the Canada Health Act, meaning that all of this money will be contributing to a system which is universal and public. They must respect the Canada Health Act, and that means that our healthcare delivery will continue to be one which is accessed by somebody's health card and not their credit card. So I'm grateful to hear that he'll be respecting that and not challenging us on the amount. I would just love to see the Conservative Party come to the table on affordability measures like our dental care plan and early learning and childcare, which is at this time saving families across the country hundreds of dollars a month.
Mm-hmm. Dr. Ellis, let's pick up on the point of what your leader had to say today in regards to the healthcare proposal, though, because Pierre Poilievre, as we heard from Mr. van Loeverden, did say that he would uphold the funding agreement if your party forms the next government. But if he thinks the funds are inadequate, and again, he said that, does that mean that he will pledge more money down the road?
I think the thing, Michael, that's very clear after listening to Mr. Poilievre today, that what we understand after 8 years of this Liberal government is that the cupboard is bare. They've spent the money. They've spent them on a lot of unusual things. And for instance, a $15 billion government handout to a company that doesn't exist. Those types of expenditures and waste is what has allowed us to get to a point as a country where we are, where we have a government that has added more to the national debt than every government before it. That is why Mr. Poilievre has made it very clear that we'll need to understand the financial situation of this country when we come to the actual solution, which is to elect a Conservative government. I want to make it clear also, Michael, that my colleague talked very clearly about mental health, but we know that they committed $4.5 billion to a Canada mental health transfer, which has never happened. There's a mental health crisis in this country. 1 in 3 Canadians are suffering with their mental health. They pledged the money. They refused to transfer it. These types of things from this government continues to make us suspicious of what their motives really are.
Mr. Davies, what's your reaction to what the federal government is proposing right now?
Well, Jagmeet Singh and our party have been pushing the Prime Minister for months and months now to sit down with the premiers to address what I think we all regard as an absolute crisis in our healthcare system across the country. So we're pleased that they sat down. We also compelled the Liberals to include a provision in the Confidence and Supply Agreement that obligated the government to provide ongoing stable funding to address the emergency crisis. So we're happy to see some money there. But let's be clear. As we start to really unravel the details of what was announced yesterday, there's a fair bit of, I think, best word is spin, worst is deception going on. There is not $198 billion of additional funding. What the Liberals are counting is $150 billion of what would have been the normal natural increase in the Canada Health Transfer over the next 10 years that preceded this agreement. The new money is only $46 billion over 10 years. That amounts to $4.6 billion a year, split between 10 provinces and 3 territories. That is not sufficient for the generational transformative change that we need. And second, I just want to comment, there was not only not a single string attached to ensure that this money goes into the public system, but actually it wasn't even raised by the Prime Minister. And the Canada Health Act is one thing, but allowing premiers to divert this money into a private, for-profit delivery, regardless of the taxpayer paying for it, is not defending public health care, and it'll risk cannibalizing our public system, making the crisis even worse.
Oh, okay, Mr. Van Loeverden, let's pick up on that point then, because if the money is not what the provinces were looking for, how does that protect this country's public health care system, or is the government willing to accept greater privatization as a means of solving the health care crisis?
Well, I would like to address one thing first of all. The Prime Minister was very clear in both the press conference yesterday and question period today that all of these dollars will respect the Canada Health Act, which means that all of this funding and healthcare will continue to be delivered in a public system and universally, not with somebody's credit card, but with their health card. That's what Canadians expect and deserve. That's what they've always come to expect.
But respectfully, the Canada Health Act doesn't prohibit privatization. It just means that there's meant to be public access where dollars wouldn't determine one's access to health care, but it doesn't prohibit privatization.
The Canada Health Act does stipulate that it needs to be delivered publicly and universally, and that's point one. Point two is on mental health. In 2017, this government committed $5 billion to mental health across the country. That was the first investment. Yesterday, we committed an incremental $2.4 billion to mental health across the country through that same transfer. And there are and will be further investments, including initiatives that we've worked with each other on, like a 3-digit hotline for mental health, and many more services as well. I couldn't agree more with my colleague that there is a mental health crisis, which includes addictions. And I would point out also that the Conservative Party has been very clear about how and notionally how they would deal with the addictions crisis across this country, which is completely outside the realm of science and evidence. It's actually a dangerous proposal that puts people's lives at risk. So I think this plan continues to be one that's directly in line with 5 priorities that we've laid out. We've also got a $2 billion investment in pediatric care because that was very, very clearly articulated from Children's Healthcare Canada and many other organizations that caring for children is not like caring for tiny little adults. It's very, very different. There's also a $2 billion provision for Indigenous health, which is delivered by the federal government as well. So to suggest that there are no strings attached or there aren't clear priorities is a false notion.
Dr. Ellis, how do you respond to that? Because as you heard, over the last couple of days, there's been a great concern about privatization. Is that something the Conservative Party would be concerned about?
Well, I think, Michael, I would take great umbrage with what my colleague said in terms of these funding announcements for mental health. If you're not actually transferring the money, you can talk about it all day long, and it really doesn't make any difference in the lives of Canadians who are out there suffering. 5 million Canadians without access to a family doctor, 1.2 million Canadians waiting for procedures. We know that these are issues that we get emails about every day, and I'm sure that my colleagues do as well, and I find that difficult to believe that they want to continue to ignore that. We talk about, my colleague talked about pediatric strategies. You know, we have a government that can't even get simple things like acetaminophen and ibuprofen on the shelves. We know that from the website drugshortages.ca that every pediatric antibiotic that I would have used as a family physician is now in stage 3 shortage. These are things that are unconscionable for a country that we all know and love, that we have this incredible healthcare system that is, in the words of the former president of the Canadian Medical Association, we have a system that is collapsing, on the brink of collapse around us. And to think that these measures that this government is announcing are going to help that and actually get in the hands of Canadians and make a difference in their lives and in their health, that is absolute falsehood.
Mr. Davies, do you share the same assessment?
Well, pretty much. But look, I mean, there's different positions and takes on things, but then there's facts. And the fact is that the Canada Health Act does not prohibit private delivery through a for-profit clinic. And that's what Doug Ford and the other premiers are doing. And so it's misleading and deceptive for the Liberals to try to portray that they're standing up for the public system when they have attached no string to make sure that the additional federal funds go to the public healthcare system. And what the warning is that the problem in the healthcare system, one of the major ones right now, is a shortage of healthcare workers who are getting burnt out in the public system. If we open up more private for-profit clinics, it's well known that there's going to be a drain on personnel from the public system, making wait times longer and jeopardizing the problem in the public system, exacerbating the crisis. And so Canadians need to understand that. This is not a defense of public health care. It may be a defense of the Canada Health Act, but not of public health care. And we're going to keep fighting to build up our hospital system and our clinic system because we know it's the cheapest, most effective, most equitable way to deliver care in this country.
Well, as I said, the provinces are right now reviewing the proposal. Canadians still learning more about it. So without a doubt, we'll continue our conversation down the road. But for now, Mr. van Loeverden, Dr. Ellis, Mr. Davies, thank you for the time.
Thank you, Michael.
Thanks, Michael.